Hello and welcome to Module 1, Introduction to Epidemiology. This slide set is going to cover epidemiology in the context of public health, which is part 1 of this module. Part 2 of this module will be covered in a different slide set. So the learning objectives for Module 1, Part 1 are to define the 10 essential public health services and then explain how epidemiology fits in the broader contexts of these 10 essential public health services. If we look at the definition of health, we see that it encompasses a broad range of conditions. Health requires physical, mental, spiritual, and social well-being. Ensuring conditions so that people can be healthy is the job of public health. And in order to ensure physical, mental, spiritual, and social well-being, public health requires that society work together collectively. So as you know, public health is everywhere. It is a part of the infrastructure that keeps our communities safe and healthy. But public health services may go unnoticed within a community because they are often, but not always, preventative versus reactive. For example, which community service are you more likely to notice? An environmental health specialist inspecting the safety of a local university's food service establishments, or a fire truck speeding down the street with its lights and sirens on? So despite having a relatively low-profile status, public health services play a key role in assuring the health and well-being of communities. And the 10 essential services have the potential to create a comprehensive infrastructure that can provide a supportive context for any public health priority in a community. This slideshow is going to show you some of the key ways in which professionals come to the table with different training perspectives and approaches to health priorities in communities. Public health and medicine both have a primary intervention focus. The public health model focuses on the population, and the medical model focuses on the individual. A service ethic does underlie each model. The public health model is based upon a public service ethic that is tempered by the concerns for the individual, whereas the medical model is based upon a personal service ethic that is aware of social responsibilities. In the public health model, the emphasis is on community-level prevention and health promotion. In the medical model, the emphasis is on the individual patient diagnosis, treatment, and care. Finally, public health interventions target the environment, human behavioral lifestyles, and medical care. And medicine's primary intervention is medical care itself. Public health has made some great achievements between 1900 and 1999. Life expectancy has been extended in part by all of these achievements. There are now 50,000 fewer cases of smallpox than occurred in 1900, 900,000 fewer cases of measles than occurred in 1941, 21,000 fewer cases of polio than occurred in 1951. Programs of population-wide vaccinations have resulted in the eradication of smallpox, the elimination of polio in the Americas, and control of measles, rubella, tetanus, and diphtheria in the U.S. and other parts of the world. Also, since 1925, the annual death rate from motor vehicle travel has decreased 90%. Seatbelts have saved approximately 85,000 lives. Child safety seats have reduced the risk of infant death by 69%. Community awareness and driving while intoxicated regulations have helped reduce alcohol-related deaths by 32%. Infections such as typhoid and cholera, which used to be major causes of illness and death early in the 20th century, have been reduced dramatically, mainly because of improved sanitation. Also, the discovery of antimicrobial therapy has been critical to successful public health efforts to control infections such as tuberculosis and sexually transmitted diseases. Deaths from coronary heart disease and stroke have declined due to risk factor modification, such as smoking cessation and blood pressure control. Since 1972, death rates for coronary heart disease have decreased 51%. Recognition of tobacco use as a health hazard in 1964 has resulted in reduced use and reduced exposure to secondhand tobacco smoke. Healthier mothers and babies are a result of better hygiene and nutrition, antibiotics, access to health care, and technology in maternal and neonatal medicine, and also immunizations. Since 1900, the infant mortality has decreased more than 90%, and maternal mortality has decreased 99%. So what are the 10 essential public health services, and who developed them? From 1988 to the early 1990s, the recognized core functions of public health were assessment, policy development, and assurance. In 1993, with a new presidential administration and federal and state attempts to reform the healthcare system in the United States, public health leaders decided to set forth a more detailed and utilitarian consensus statement that would speak with one voice to public health professionals, the general population, and the policymakers who would shape healthcare reform. Public health leaders worked to define a more detailed model of the core public health functions. The end result was a consensus statement that included the 3 recognized core functions and the 10 essential public health services. This statement was adopted in 1994 and over the years has proven to be a critical foundational framework for public health responsibilities. This graphic, developed by the CDC, shows the 3 core functions in the 10 essential public health services. Every public health professional should be familiar with these functions and services, since they do form the backbone of all public health work. The core functions shown around the edge of this wheel are assessment, policy development, and assurance. Assessment is surveillance of disease and other health outcomes. Policy development is the process of translating surveillance information into programs and policies. And assurance is taking steps to make sure that policies and programs do indeed improve health outcomes. Next, let's walk through the relevance of epidemiology to each of the 10 essential public health services. Essential service number 1 is to monitor the health status to identify and solve community health problems. While this slide presents a list that is not exhaustive, it will give you a feel for the scope of activities encompassed by this essential service. The list includes identification of health risks and determination of health service needs, utilization of technology and other methods to interpret and communicate health information to diverse audiences in different sectors, attention to the vital statistics and health status of specific groups that are at a higher risk than the total population, and collaboration in integrating and managing public health-related information systems. All of the activity listed on this slide are relevant to the work conducted by epidemiologists, and you will learn more about this throughout this course. Essential service number 2 is to diagnose and investigate health problems and health hazards in the community. This is directly tied to the activities conducted by practicing epidemiologists. Service implementation includes epidemiological identification of outbreaks, patterns of infectious and chronic diseases and injuries, public health laboratory capability using modern technology to conduct rapid screening and high-volume testing, active infectious disease epidemiology programs, and technical capacity for investigation of disease outbreaks and assessing patterns of chronic disease and injury. Epidemiologists monitor patient diagnoses and other disease reports to assess levels of disease in the population, investigate problems, and recommend prevention measures. Laboratory confirmation of epidemiological specimens is one key method used to identify disease patterns and outbreaks. At the local level, public health laboratories provide diagnostic and research services to the communities that they serve. Public health laboratory professionals work to accomplish such tasks as newborn screening, identification of outbreak pathogens, and identification of novel viruses and bacteria. The third third essential service is to inform, educate, and empower people about health issues. This includes health information, health education, and health promotion activities designed to reduce health risks and promote better health. Health communication plans and activities such as media advocacy and social marketing, accessible health information and educational resources, and health education and promotion program partnerships with schools, faith communities, work sites, personal care providers, and others to implement and reinforce health promotion programs and messages. Public health epidemiologists use information in a variety of ways to communicate both internally with public health colleagues and externally with physicians, the media, and the public. For example, in 2009, there was a significant amount of media and public attention focused on the novel influenza H1N1 variant. During these types of situations, epidemiologists work with a team of colleagues, including a designated public health information officer, to develop and disseminate press releases and specialized educational materials so prevention and healthcare access information can effectively reach target populations. The fourth essential health service is to mobilize community partnerships and action to identify and solve problems. This includes convening and facilitating partnerships among groups and associations, including those not typically considered to be health-related, to undertake defined health improvement projects, including preventative, screening, rehabilitation, and support programs. It also includes building coalitions to draw upon the full range of potential human and material resources available to improve community health. Epidemiologists have a significant role in the collaborative elements of community partnerships. Public health preparedness and response draws upon many sectors of the community and many public health specialties. For example, both before and after Hurricane Irene hit the East Coast in August of 2011, medical and public health professionals, including epidemiologists, worked diligently to mobilize community and national resources to protect and restore basic sanitation, provide emergency shelter, treat and prevent disease and injury, and address factors contributing to stress and mental health. The fifth essential public health service is to develop policies and plans that support individual and community health efforts. This pertains to systemic, community-level, and state-level planning for health improvement in all jurisdictions, development and tracking of measurable health objectives, establishing strategies and actions to guide community health improvement at the state and local level, and development of legislative codes, rules, regulations, ordinances, and other policies to enable performance of the essential public health services. Particularly in the context of pandemic and other preparedness and response initiatives, epidemiologists and other public health professionals in most states are working to enhance community and state-level plans to better coordinate between jurisdictions and agencies so that daily public health services are carried out competently and that systems are already being used in the event of a public health emergency. One example of legislation that guides the practice of public health at the state level are the communicable disease reporting laws that regulate public health surveillance in each state. The implementation of Essential Service Number 6 reflects many duties of practicing epidemiologists. This service is the enforcement of laws and regulations that protect health and ensure safety. This service includes enforcement activities in the areas of public health concern, including but not limited to the protection of drinking water, enforcement of clean air standards, regulation of care provided in healthcare facilities and programs, reinspection of workplaces following safety violations, review of new drugs, biological and medical device applications, enforcement of laws governing the sale of alcohol and tobacco to minors, seatbelt and child safety seat usage, and childhood immunizations. The seventh essential service is to link people to needed personal health services and assure the provision of health care when otherwise unavailable. This means identifying populations where barriers to personal health services exist, identifying personal health service needs of populations with limited access to a coordinated system of clinical care, and assuring the linkage of people to appropriate personal health services through coordination of provider services and development of interventions that address barriers to care, such as culturally and linguistically appropriate staff and materials, and transportation services. While you might not think an epidemiologist's primary role is that of linking people to health services, there are in fact instances where this occurs. For example, in post-hurricane response, public health professionals, including epidemiologists, conduct door-to-door rapid needs assessments in affected populations. While one purpose of the needs assessment is to conduct interviews and collect data to be analyzed, epidemiologists also assure the provision of healthcare services by overseeing follow-up and referrals to the disaster victims to appropriate agencies and resources. And when any survey is implemented, it must be linguistically appropriate. For example, some counties might require a Spanish version of the Rapid Needs Assessment Survey instrument. The eighth essential service is to assure a competent public health and personal health care workforce. In order to do this, there must be education and training for personnel to meet the needs for public and personal health services, efficient processes for credentialing technical and professional health personnel, adoption of continuous quality improvement and lifelong learning programs, partnerships with professional workplace development programs to assure relevant learning experiences for all participants, and continuing education in management, cultural competence, and leadership development programs. Pandemic or emergency preparedness and response programs in some states may oversee training to prepare the public health workforce for preparedness and response, in addition to the traditional public health functions that prevent, detect, and respond to morbidity and mortality in communities. Some specific ways in which public health staff in local health departments train are via tabletop exercises or group case study exercises in which their role is to role play and problem solve, and actual field exercises that test the response to coordination, capacity, and times, as well as the overall technological and staffing infrastructure. Essential service number 9 is to evaluate effectiveness, accessibility, and quality of personal and population-based health services. This involves the evaluation and critical review of health programs based on analyses of health status and service utilization data. These analyses are conducted to determine program effectiveness and to provide the information necessary for allocating resources and reshaping programs for improved efficiency, effectiveness, and quality. One type of data that is helpful in ongoing evaluation of health programs is surveillance. Surveillance is a key activity conducted by epidemiologists, and that is why we will devote an entire module to this topic later in the series. Let's again use the example of influenza. In the context of essential service number 9, epidemiologists might monitor influenza vaccination rates to determine whether or not high-risk populations are being reached. Or they may monitor the geographic distribution of vaccinations to see if there's enough vaccine to reach the number of people living in a particular community. The 10th essential service is to conduct research for new insights and innovative solutions to health problems. This includes having a linkage with institutions of higher learning and research, ensuring an internal capacity to mount timely epidemiological, such as outbreak investigations, and economic analyses, for example, cost-benefit studies, and having an internal capacity to conduct needed health service research. For example, survey design, conducting interviews and facilitating focus groups, conducting clinical trials, and assessing and using public records. There are many relevant places for the practice of epidemiology within the activities associated with essential service number 10. For example, in the event of an outbreak, epidemiologists working at local or state health departments need to know how to conduct an investigation. Keeping up on any new research related to that disease being investigated may assist epidemiologists in understanding what is causing people to get sick. In addition, the epidemiologist must be able to design surveys and conduct interviews. all things that are done in an outbreak investigation. Now I'd like to tell you a story. There was a young orthopedic surgeon named Dr. Treatment. He had the best training, Yale Medical School and a residency at Mass General Hospital. When he finished his training, he went into practice in an office that happened to be located a block from a senior housing complex. His practice grew and it thrived. Patients who were mostly elderly came to see him with all kinds of broken bones, fractures in the upper and lower limbs, wrists, fractures and hip fractures, simple fractures and compound fractures. Before long, he had more patients than he knew what to do with. But Dr. Treatment fixed all of them, and his reputation grew, and his practice evolved in the specialty of geriatric orthopedic surgery. Now, a young epidemiologist named Behavior Modification who worked for the city health department was interested in fractures. She mapped the occurrence of fractures over the past 5 years by census tract, and she found the incidence rate of fractures in one particular census tract to be 8 times that of any other census tract in the city. That census tract happened to be one in which Dr. Treatment's office was located. The young epidemiologist Behavior Modification did some further investigation and was able to localize the excess of fractures to the senior housing complex, which was located near Dr. Treatment's office. So the City Health Department initiated an educational campaign in the housing complex about how to prevent falls and offered all the residents safety audits of their apartments and in-home physical therapy consults. As a result of the latter, the health department distributed canes and walkers to many residents. 2 years went by and Dr. Treatment's geriatric orthopedic surgery practice continued to grow. He developed new innovative techniques. He gave lectures all around the world. He received honorary degrees from Johns Hopkins and Stanford. Meanwhile, epidemiologist Behavior Modification did an evaluation of the effectiveness of the intervention and found that the incidence rate of fractures among residents of the senior housing complex had decreased by 20%, but that the rate was still much higher than the rates among elderly persons living in other census tracts in the city. At this point, Behavior Modification called the Center for Disease Control and Prevention to do further investigation. When Dr. Public Health from the CDC arrived into the city, she questioned all the fracture victims in the senior complex about the circumstances of their fractures. It quickly became apparent that most of the fractures had occurred from falls that had taken place at a spot about 1 block from the senior complex. Dr. Public Health went to that spot, which happened to be located on the sidewalk directly in front of Dr. Treatment's office. She found a gaping hole in the sidewalk, a hole that Dr. Treatment had never noticed in all his years in practice. The next day, city workers repaired the sidewalk, and from then on, the incidence rate of fractures in the senior complex was the same as the rate among the elderly in other parts of the city. And Dr. Treatment's once thriving practice shrank precipitously. So what are the lessons from this story? Number 1, medicine for the most part focuses on treating sick patients and not preventing them from getting sick. Much of public health focuses on prevention through convincing individuals to make behavioral changes, such as to stop smoking, to eat less red meat, or to use a cane or a walker to prevent falls. And this, of course, is really important. But the highest form of prevention often involves making structural changes in the social or physical environments that promote the health of broad segments of the population or even the entire community. Examples of this are fluoridation of the water supply, modern sewage systems and water treatment plants, pasteurization of milk, mandatory vaccinations for certain infectious diseases, banning of cigarette advertising, asbestos and lead in gasoline, taxing of cigarettes, needle exchange programs to prevent HIV infection, and designing communities with sidewalks, walking and bicycle paths, playgrounds, and other features that promote physical activity. Changing the environment to improve public health as opposed to changing individual behavior, one person at a time, is the core of public health that epidemiologists and public health professionals should always try to keep at the forefront of their thinking. This course will focus on epidemiological concepts and methods. And as you begin to master these concepts and methods, and as you become facile in epidemiological thinking, don't lose sight of the fact that epidemiology, which is considered the core science of public health, is not an end in itself. Rather, epidemiological studies are a means for gaining knowledge to help prevent disease and disability in populations and to improve the population health. But what is epidemiology really? Epidemiology is the study of the health and disease of the body politic, the population. Clinicians prevent, detect, monitor, and treat disease in individual patients. Epidemiologists prevent, detect, monitor, and treat disease in populations. Epidemiology is the basic science of public health. Epidemiological studies provide the basis for public health practice and policy making by attempting to find out what causes disease, what causes diseases to spread, what prevents disease, and what works in controlling disease. Of course, other disciplines are concerned with these questions too. Many fields evaluate programs. One difference is that epidemiologists emphasize evaluation in relation to health outcomes rather than processes such as utilization of services. However, epidemiologists are not the only professionals concerned with health outcomes, nor with the cause and dissemination of disease. But when other people study health and disease in populations, then they are practicing epidemiology. In this course, we will explore more about what epidemiologists do, and hopefully you will get excited about the practice of epidemiology.